Hi, my name is Manali Kamdar. I'm an associate professor at the University of Colorado Anschutz Cancer Center. I'm going to walk you through some of the key trials that have led to FDA approval of newer agents, and that has certainly unleashed a whole new toolbox in patients for us to treat patients with relapsed refractory lymphomas. The second study that came out at ASH was a study with respect to Pirtobrutinib. Pirtobrutinib is a reversible non-covalent Bruton tyrosine kinase inhibitor, and Pirtobrutinib has been successfully tested in a phase 2 clinical trial called the BRUIN study in patients with CLL, relapsed refractory CLL, and relapsed refractory mantle cell lymphoma. And in this study, the net is that these patients were heavily pretreated. Nearly 95% of patients were pre-exposed to a BTK irreversible inhibitor like ibrutinib or acalabrutinib. And at this point in time, Pirtobrutinib has received FDA approval in patients with relapsed mantle cell lymphoma after failure of 2 lines of treatment. Going back to mantle cell lymphoma, as you all know, it's a chronic, heterogeneous, treatable, but incurable disease, which means relapses are imminent. When patients typically relapse, the first-line strategy for most of us is to do a irreversible BTK inhibitor like ibrutinib or a second-generation inhibitor like acalabrutinib. And when patients fail that, they typically have fewer agents on hand. And in this setting, CAR T-cell therapy has actually shown exceptional promise with a CR rate of nearly 67%. However, CAR T is probably not accessible to everyone else. And this is exactly where Pirtobrutinib fits in very well. So in the third line setting now, we have a drug that is FDA approved. Pirtobrutinib has good responses and a PFS of about a year in heavily pretreated mantle cell lymphoma patients. It is exceptionally well tolerated outside of minor fatigue, bruising. As a result, I do believe this would be the new standard of care for patients with relapsed refractory mantle cell lymphoma in the third line setting. In terms of the approach that we clinicians use for patients who have had a prior BTK inhibitor with relapsed mantle cell lymphoma, I would say at this point we have 2 strategies. We could either offer them CAR T-cell therapy. FDA-approved brexacaptogene is now approved in the relapsed mantle cell lymphoma setting, or we could use Pirtobrutinib. I think my preference would be to go with a one-and-done treatment, such as CAR T-cell therapy. It has a longer follow-up. Patients don't have to take treatment until progression. So clearly that's preferred, but not all patients are CAR T eligible. And I think in those patients, Pirtobrutinib would be a very fine choice for patients in the third-line mantle cell lymphoma setting.